Stan. I appreciate it very much. Hello, HITLAB and Breakthrough Alliance community. I have the great pleasure today to be interviewing Robert Rodriguez, who is the founder and CEO of HelixVM. And I'm really excited to talk to you today, Robert, so welcome. We always used to like to start, the first question is always kind of the same because we have an audience that may not know who you are or about your journey. And so the first question is always, Robert, can you tell me, the audience and myself, a little about your career journey, how you started and how you became CEO and founder of HelixVM?
So, long career journey, I guess, so over 30 years. Started originally in a benefits consulting firm here in the New York area, where I worked there for a couple of years and moved on to business school. So post-business school, I went to the Ross School, University of Michigan. And post-Ross, I went to a consulting firm called Booz Allen and Hamilton way back in the day. And then I went to GE Capital. So did the corporate thing, obviously, post-college. Realized I wasn't a corporate guy. So I thought to myself, okay, let's go do some startup work. And then I had the luck of running into a company called Triana. They were a fintech startup based in New York, an Israeli founder, and did really, really well. Was there for a few years, moved the company out to California, raised money from Sequoia Capital, ended up getting sold a few years later. But company did really well. Had the privilege of working there for a while, but again, still had the bug of kind of being on my own. So, and in none of this, there's healthcare at this point in time. I mean, if you really look at it. So in 2003, I was looking to do something, on my own in healthcare, and my wife said, "Why don't you move to South Florida? There's lots of old people there to do healthcare." So I said, "Okay, I'll move to South Florida," and I got into the outpatient medical space, where I basically started to do urgent care, doc in the box type of service offerings, and that's kind of where my real hardcore entrepreneurial journey started. It's obviously bootstrap. It's pretty much you out there in the cold wild, and I've been involved in some way, shape, or form for the last 20 years in some version of outpatient medicine, and then obviously COVID hit. And that's kind of where the HelixVM story starts.
Right. So before I get into some details about today's theme, can you just tell the audience just a little bit about what HelixVM does?
HelixVM is, in essence, a doctor's office on the cloud where we partner with doctors. We're not the doctors. So if you can imagine, when you go into your physician's office, there's people who check in, there are people who take your blood pressure, there are people who check out, there's people who help you with authorizations. We basically do all of that administrative function, in essence, in a cloud-based environment. And so obviously a lot of what we do is very driven by just kind of understanding workflows of how a medical office works, and understanding also how patients behave as well as how doctors behave. And that's, I think, sort of the magic to what we do, is working on both ends to make a super high efficient transaction for both parties. And we can do that whether it be on the cloud, or we can do it whether the patient's in your office. It doesn't really, we're ambivalent in terms of where the patient or the doctor are at any point in time.
And so today's theme a little bit is talking about the outpatient experience. And so outpatient medicine has seen significant growth over the past decade. How would you describe the current business landscape for outpatient practices, and what are maybe some of the primary factors driving profitability in this space today?
Okay. Well, I think that, as a person who's been an outpatient for a while, I would say that, yes, volumes have grown overall for the industry. I think that the reimbursement environment is pretty tough for many physicians. I also believe that some of the issues on the consumer side are making it also difficult, because a little bit of everything a doctor collects is what they collect from the patient, right? It's not just the insurance company that pays, it's the patient who also pays. And there's a lot of struggle there, I think, on most physician practices. And so what you've seen, I think, over the last, since I've been in the business for 20 years, is a little bit of a stagnation from an income perspective for physician and in the outpatient space, and an increasing amount of physicians doing other things in order to complement that. So if you're a cardiologist, you start to do a lot of ancillary and professional the technical component of your work in order to supplement that and to have a thriving business, in essence, as a business owner. And so I think that is a struggle, which is to say, physician income or physician profitability. And obviously, post COVID, it was an even bigger issue because for a lot of physicians, their practice just disappeared overnight because they had no method of actually servicing patients who didn't want to leave the house, or for staff who didn't even want to go into the office. So that's kind of where the idea of HelixVM is born: is how do you close this gap where physician and patient aren't necessarily meeting, but you need to conduct medicine in some capacity because it's necessary just to continue to manage the patient's health.
Okay. So Robert, I want to talk a little bit about artificial intelligence. First, let's start at a sort of a high level, and then we'll get a little more granular. But we're seeing artificial intelligence increasingly being implemented, in healthcare technologies today. Can you share some specific examples of how AI has helped outpatient practices streamline operation, improve patient care, and maybe what improvements you've seen in terms of time and cost savings?
Well, I think the most common use case and the one that people get the most excited about in AI, and we have an AI in our platform, is in essence in decision support for the physician, which is helping with the basics of triage, coming up with a differential diagnosis, helping the physician determine possible treatment scenarios. So in essence, kind of like a mid-level. I mean, I don't know if folks like a physician assistant, for example. And basically supporting the physician in their decision making, because again, one of the things is they've got to see patients, right? You got to move patients in the outpatient world. So AI has been very helpful for us in terms of doing that, and in terms of giving physicians, cutting the amount of physician time when actually looking at a chart, or even when looking at a patient. Increasingly, and one of the things that we're working on in our platform in order to help with both physicians and patients, is using that AI to handle the basic questions. I mean, we get tons of questions from patients because we do a lot of asynchronous medicine within our platform. So where AI would be really, really helpful, and we're just starting to really play with it, is question like, what's going on with my insurance? What's happening with my prescription? I'd like to change my pharmacy. And those are things which I think at the end of the day, the use case for AI might be much stronger and much more helpful for the physician community, for the outpatient world. Because, I mean, if you've gone into a doctor's office, there's a lot of support staff. And that support staff is stressed, a lot of work. And AI would really be able to at least take, 50, 60% of the common stuff, in essence, off their plate. But obviously, rolling that out is a little bit more than just a science project, shall we say. So you got to be able to put it in the field. You got to be able to fine tune it. You got to be able to put policies in addition to the basics that most of these AI agents do.
So let's talk a little bit more about AI. While AI has potential, there is some common sentiment that it's not enough on its own to drive substantial change. What do you see as maybe some of the key limitations of AI in outpatient medicine, particularly when it comes to revenue generation or improving actually patient outcomes?
Well, I think that in terms of where it can really help, I think physicians in the outpatient space is, in essence, there are some use cases in the billing space, which is to say to be able to find opportunities to code the claim better, which helps on the professional component. It allows them also to identify additional items that are billable environments for in the insurance space. And that would make a big difference because, as you know, every contract for physicians with a carrier is different. Some of them pay you this, some of them pay you that. There is no one standard contract. And certainly when you move away from the Medicare and Medicaid space where things get a little bit messier in terms of how contracting works. So I think that AI has a really good use case in terms of increasing the yield on a per claim basis to find additional billable events. Where AI, I think, is probably going to take a little bit longer is, again, on the science part, which is helping the physicians sort of understand how should I treat the patient and with what should I treat the patient. So things like, if a patient comes in and they're taking drug X, but it's possible that there could be a use case for a different drug Y, and helping the physician sort of work out the thinking there, because I've been prescribing X for so many years, I'm familiar with it, what is Y going to do? Knowing full well that they're similar, or that there's maybe an off-label or an off-brand use for it. And I think that there's a world of opportunity there to help not just the not just the profitability of the physician practice, but also in the delivery of actual medicine that makes an impact for patients.
I'd like to follow up on that as we talk about the patient. Many outpatient practices rely on a personal, patient-centered approach, which can sometimes be at odds with the clinical efficiency that AI offers. So the question is really, how can outpatient practice strike a balance between leveraging AI but maintaining the human elements of care that patients value, sort of that one-on-one feeling that you get when you actually see a physician?
Yeah, that's actually in the sweet spot in terms of what we're working for at HelixVM. I mean, what we're trying to do is sort of step change improvements, and basically it starts with a recognition from the physician-patient relationship that there are certain things that the physician wants to know about the patient, but they don't need to see the patient. It's what we call the asynchronous medicine piece, right? Which is there's a billable event, there's medicine that needs to be performed, and I can use technology in a way that it's a lot of patient self-servicing, while at the same time sort of divorcing the physician from having to invest the time with the patient. Classic examples are things like refills, where I'm not feeling well, I need an antibiotic or something along those lines. Those types of medical interactions many times can be done asynchronously, and AI plays a role in that, in kind of smart workflows. That should hopefully then free up the physician more time to basically spend to in essence focus on the higher acuity cases that they would have inside their practice, right? Because there's a continuity, right? From the simple to the really, really difficult, from the not too sick to the really, really sick. And so I think that if you use, the AI and use a platform intelligently, you're able to, in essence, condition the patient to work in a self-service environment, receive the medication and the care that they need without actually physically seeing the doctor, while at the same time, when there is a higher acuity case, identify that patient and basically put it to the top of the queue, so that way the doctor can say, oh, wow, this hit my radar screen. This is really, really important. There could be a major problem there. That is just workflow and policy and clinical policies. Then the beauty of it is that you can layer on top of it some of the, the fancy stuff with respect to, AI agents, video images of the doctor that would allow that patient to have an interaction similar to the one we're having, but actually have it with an AI agent, or with as we call it, an avatar MD. And I think once you start layering that, that's not that far off. I think that you'll get a lot more patient comfort with it. I mean, they'll know that they're talking to an AI, but they'll have the ability to, in essence, conduct some of this low acuity medicine in a very, very friendly environment, while at the same time knowing that the system that are put in place will bump them up if there's something that requires, in essence, a higher standard of care.
So we have time for one last question, and your last answer kind of made me think of this one. As we look ahead, not only just AI, but just technologies that are entering into outpatient care for medicine, what technologies or things do you see advancing the space, even beyond AI? And you mentioned, even kind of using avatars, which partly is the use of AI, but kind of a new way to interface. So just kind of your view of the future.
Well, my view of the future, and again, this is sort of a little bit of a sweet spot, so I'm talking my book a little bit here, but my view of the future is that I think a couple of things are really important. I think the first is, the idea of like kind of the home monitoring, the hospital at home, and keeping, in essence, sort of a control panel of your customers, right, of your patients, and understanding like these folks are okay, these folks need care. And using third-party data, which is compiled on a daily basis, monitoring, using AI to basically dynamically adjust the diagnosis. And if something trips, to say, hey, this is urgent, in essence, you're escalating it. So I think that using remote patient monitoring tools, which are physically speaking, usually hardware, in the home, connecting it into a system that allows you to, in essence, monitor and let the doctors know where things are. That's really important, for example, in value-based medicine, okay, for the physicians. It also allows them to code things better and bill things better. So I think that's number one. I think the second piece that would really be important is systems that allow physician practices, when they're prescribing in particular, to have a lot more integration with downstream where the fulfillment happens. I can't tell you how many times you have a patient say, well, I got a prescription for this and I wanted it to go to this pharmacy, but it can't go here because not only are they not under contract, they don't have inventory. So things like whether you're under contract and inventory should be things, frankly, today with the technology we have, that should be done real time. A patient should have a pretty good idea within a few minutes if their prescription goes somewhere, or if their order or a directive from the doctor goes somewhere, what the status of that is relative to supply, physical supply, but also with respect to reimbursement. Because those are the questions that come back to us. Oh, I need to change the prescription. I'd like to move it over to this pharmacy. I'd like to go to a different doctor. They're not in network. They are in network. They aren't. And so I think that technology that helps the supply chain, in essence, is, I think, extremely valuable in the patient servicing and making the experience a lot more seamless for the patient, as well as just, frankly, less headaches for the doctors, right? The phone doesn't ring as much, and that's a good thing for the practice.
Well, first, let me say thank you, Robert. I learned a lot today, not only about your journey, and also about your company, HelixVM, but also kind of about the industry and where you see the future of outpatient services going. So thank you for joining us today.